Good morning. I would like to thank every one of you for being here with us at this live session from MAHSA University, Saujana Putra campus. I'm Deborah, lecturer from Faculty of Health Sciences, Nursing and Education, MAHSA University, and I will be moderating today's session. Today's webinar, Hippotherapy in Pediatric Physiotherapy, is proudly organized by the Faculty of Health Sciences, Nursing and Education, MAHSA University. Dear viewers, before we proceed further, I would like to give you a brief overview of the programs offered by the Faculty of Health Sciences, Nursing and Education at MAHSA University. The faculty is made up of the School of Education, School of Physiotherapy, Department of Environmental Health, Department of Medical Imaging, and School of Nursing. We are offering several programs under each department. Under the School of Physiotherapy, we offer Diploma in Physiotherapy, Bachelor of Physiotherapy, Bachelor of Physiotherapy ODL, and Master of Physiotherapy. Under the Department of Environmental Health, Diploma in Environmental Health, Bachelor of Environmental Health and Safety, Environmental Health and Safety ODL, and Diploma in Occupational Safety and Health is being offered. Under the Department of Medical Imaging, we offer Diploma in Medical Imaging, Bachelor of Medical Imaging, and Bachelor of Medical Imaging ODL. So what are the benefits of joining the Health Sciences program? There is a high job demand where we are essential service providers. There will not be a boring work routine as we have various specializations. There are lucrative remuneration. There is an opportunity to work in a variety of settings, which will pave the way for a successful and satisfying career. Now let's look at the programs offered. Under the postgraduate program is Master of Physiotherapy, both in the full-time and part-time mode. And these are the entry requirements. Under the undergraduate program at a bachelor's level, we have Bachelor's of Physiotherapy, Bachelor of Environmental Health and Safety, Bachelor of Medical Imaging, both in the conventional mode and the ODL mode. Here are the entry requirements. Next is the diploma programs. We offer Diploma in Physiotherapy, Diploma in Environmental Health, Diploma in Medical Imaging. And these are the entry requirements. Next is the Diploma in Occupational Safety and Health. And here are the entry requirements. For further information on all of our programs and any queries, kindly visit our website, www.mahsa.edu.my, or drop us a comment and we will get back to you. And infinite excellence is what MAHSA aspires to provide to each of its graduates. So why the Faculty of Health Sciences, Nursing and Education at MAHSA? It's because we have a pool of experienced and dedicated academic staff. We offer various study modes, which includes conventional and open and distance learning. We have cross-teaching by experts, where MAHSA has the most number of health disciplines in a single institution among higher private education institutions. There are interactive teaching and emphasis on hands-on clinical skills. We have a wide list of hospitals, institutions for clinical and industrial placement. And most importantly, all of our programs are accredited by MQA and JPA with international recognition. Here at MAHSA, we offer MAHSA scholarships. which includes Haji Abdullah Academic Excellence Scholarship, Foundation Scholarship, Blue Ribbon Scholarship, School Teachers Scholarship, Family Scholarship, the Single Parent Scholarship. And we have several collaborations and affiliations across the country and various national and international partnerships. We also have the student mobility program with our students visiting other university and students from other universities visiting MAHSA University. This picture shows our students visiting the lovely professional university in India. And in this picture, students from Universitas Sri Wijaya visiting MAHSA University campus. Dear viewers, if you require further information or if you would like to take a tour of our campus, please come and visit us on our open day event happening on the 28th and 29th of October from 9 a.m. to 6 p.m. We welcome you and we will be most delighted to meet you. Thank you. Please contact us through MAHSA website or through our faculty Facebook page to know more about our programs, or simply leave a comment and we will get back to you. Your questions concerning this webinar session may be listed in the chat box as well. Without further delay, allow me to introduce you to today's topic. The title of today's topic is Hippotherapy in Pediatric Physiotherapy. Hippotherapy is an intervention where a horse is used as a treatment tool to meet specific therapy objectives and goals. The rhythmic and three-dimensional movement of the horse stimulates the human gait pattern, which can have a positive impact on muscle strength, posture, and overall motor skills. This modality has been used in the treatment of various conditions such as autism, cerebral palsy, traumatic brain injury, multiple sclerosis, and developmental delays. The webinar will introduce hippotherapy as a relatively new modality in the pediatric physiotherapy. It will discuss how hippotherapy can help improve balance and coordination. And to present on this topic, we are honored to have with us today Mr. Manikandan Rangasamy.
Hello.
Mr. Manikandan obtained his bachelor's degree in physiotherapy from Tamil Nadu Dr. MGR Medical University in 1998 and completed his Master of Pediatric Physiotherapy in 2021. Having nearly 23 years experience, both academic and clinical practice, he has established himself as an expert in the field of pediatric physiotherapy. He also holds a master in psychology from Madras University. Currently, Mr. Manikandan is working as a lecturer under the School of Physiotherapy. Without further ado, I would like to pass the time to our speaker for today. Over to you, Mr. Manikandan.
Yes. Good morning, everyone. Thank you, Ms. Deborah, to give me the wonderful introduction about me. And I thank MAHSA University and our Dean, Professor Veronica Chua, to give me this opportunity. Okay, right? So I can start my presentation. So today my topic is hippotherapy. It is a new approach to treat children with physical and psychological illness. Right. Hippotherapy. So this is I follow this in Green Apple Hippotherapy Center to learn about this hippotherapy. Okay, this is a new thing. Okay, so in the medical field, using animals for the treatment. Okay, it's not a new. Okay, even we can use we have an understanding. Some sort of the animals is helping to solve a lot of our psychological problems, like a dog or cat. We usually we are using in our home. It's like a pet animals. Okay, so it will give psychologically to relieve a lot of our issues. Okay, right. So it's a horse using the treatment, horse as a treatment tool is called as a hippotherapy. It's ancient Greek words. It's the meaning of horse is a hippo. So it's using the horse to treat various illnesses. It's called as a hippotherapy. So hippotherapy, the horse is a tool. It's a therapy to derived from the evidence-based practice and sound clinical reasoning skills. So it's a using intentional movement of the horse. Okay, so just we can keep the horse as a stable as well as moving the horse. Also, we are using to induce sensory, neuromotor, and cognitive systems or influence to promote functional outcomes in individual with physical and psychological disabilities as well as various impairments. Right. So yeah, how does the hippotherapy is working, right? Hippotherapy involves in a specially trained therapist who used to have a horse as a live treatment tool. So we are using under physiotherapy, we are using various tools, okay, that are non-living things, okay, but we're using the living things as a horse, okay, need to have a proper training. So it's a properly specialized trained people can use the horses to treat various disabilities. So the movement of the horse is used to achieve long-term and short-term treatment goals that are be individualized to each patient. Right. So we need to do properly assess the patient to identify the patient's problem. So according to that, we should plan our treatment. So it's a three-dimensional movements of the horse mimics the normal movement of the human pelvis while we are walking. So we can see the legs of the moving the legs of the horse as well as the as a human when we are walking. So the pelvic movements will be most related with as a human movements. It's a rhythmic, repetitive, and multi-directional movements. It provides the horse to stimulate to the anterior as well as posterior swinging movements of the patient. So this will leads to control balance, coordination, like that in various aspects the horse, the hippotherapy is using, right? So hippotherapy as a tool in physiotherapy. So the horse itself is not the tool, rather a licensed physiotherapist. So just simply we cannot use all the horses. Same like for the simply unknown person, just we cannot able to use the horse as a treatment. Okay, so we need to have a proper training, right? So the horse itself is not a tool, rather a licensed physiotherapist leading a skilled movement and treatment strategies while using the horse as a tool, right? So here a small video I will show you about the hippotherapy, how you see. We see that various horses we are using, okay, and we can teach, right? Who can provide hippotherapy, right? Who are all can get a training as a hippotherapist? So in most countries, the hippotherapy requires a specialization, and it can be provided by the supervised by the following healthcare professionals once they have achieved the necessary training and certification. So if those who have already is a physiotherapist, occupational therapist, and speech and language pathologists, these peoples are eligible to train as a hippotherapist because these webinars, okay, a lot of the young budding physios or physiotherapy students you are attending, okay, in future you may chance to select you as a hippotherapist, okay, because we have a basic knowledge about our bodily movements, okay. So if you advance, okay, so as a physiotherapist easily we can understand either occupational therapist or speech language therapist, okay, we can easily can understand the movements of the horse and how we can train the patients with the various disabilities, right? So here you see that is our physiotherapist, okay. The students are getting training with the help of the horse, so the horse will be in stable. So when we may use hippotherapy, mostly the floor will be in sand, okay. So even though it may be any dangerous may be occur, so it not much affected, okay, because the horse is moving on the sand, okay. So need to use proper attires, all those things, right? Who can benefit from hippotherapy? So wide variety of patients in all age groups. Okay, so children under the age of 3 is not eligible. So beyond that, most of the all the age group peoples, okay, the backgrounds and medical histories can benefit from the use of the hippotherapy. Yeah, we got few contraindications also is there that we can discuss later, right? So the patient population for hippotherapy typically consists of mostly children with varying psychological and physical disabilities. So few disabilities are mentioned here as like a cerebral palsy, okay, and traumatic brain injury patients. Either the children may having Down syndrome, autistic children, they can able to control uncontrolled movements. Okay, so mostly autistic children they have a uncontrolled movements will be there. So we can sensitize the children, and various behavioral disorders can be treated with hippotherapy. Muscular dystrophy, even the person may having amputees. Okay, so after that to improve the trunk and control. Okay, so after that we can train them for gait training, all those things. Even stroke patients. Okay, so it's not acute stroke patients. Once the patients little progress, okay, once the patients need to improve their balance and posture, so that time we can utilize as a hippotherapy. Multiple sclerosis, even spinal cord injury patients, okay, during the recovery stage, rheumatic joint diseases like rheumatoid arthritis, most of the children with the developmental dysplasia or delayed development children is having the good options to take a hippotherapy, right? As a physiotherapist who specialized training in hippotherapy is able to provide treatment plans. It's tailored to patients. Yes. Okay. So we need to do proper assessment. Okay. Before you can take children's for hippotherapy, the child must be properly assessed by the pediatrician first. Okay, because the child is ideal to take a treatment or not. Okay, so various questionnaires will be there. So same like as a therapist also, before you start your hippotherapy treatment to the child, you need to do a lot of the assessment things. Okay, then we can check the child is ideal to take the treatment or not. Okay, right. So physical needs and the ability to ride, the therapist will manipulate the horse's movements as well as the rider's position to attain functional outcomes. Mainly, we can treat these are all the problems can get recovered with the help of the hippotherapy, like a gait training. Okay, so if the child may having difficulty in walking or abnormal walking pattern, they may have. So this may be the reason due to they may having improper pelvic control. Okay, so when we train the child with the hippotherapy to gain the pelvic control. Okay, so then we can train them for walking. So it will be improved in walking. Same like for balance and postural control. Okay, so they won't develop in the trunk control, not be proper. Then we can train the child with the hippotherapy, and even they may having weak muscles, muscle strengthening to improve the joint range of motion. Either the person may having hypertonicity or hypotonicity, both the things we can use it as a or as a tool. And proprioception is the joint position sense. Okay, due to the joint position sense is improper, then the child cannot able to stand, frequent falling. Okay, so walking difficulties, all those things will be there. So we can train them in improve the joint position sense with the help of the hippotherapy, and we can induce the vestibular input like a auditory cues and visual cues. Okay, so these all those things to improve, right? So what are the benefits is like a muscle tone as well as the improved strength, both gross and fine motor skills. Okay, even the child may having difficulties in the fine motor like finger usings. Okay, those who have delayed milestone children's, okay, is having the very good in the gross as well as fine motor skills. Joint range of motions can improve the coordination as well as balance, to improve the endurance. Okay, symmetry. If the child may having some abnormal postural symmetry, postural correction also we can do with the help of the hippotherapy, and the child can able to create awareness of the body and the mobilization of the pelvis, even lumbar region and hip joint, even head and the trunk control also can get improved. Right. Same like for the body awareness, posture and mobility, even hand-eye coordinations will be improved. Okay, limbic system functions will be related arousal, motivation, and attention span. So in the psychological aspect, okay, sensory motor function, even oromotor ability. Okay, that's why there's even speech pathologists also can get trained as a hippotherapist, okay, to improve the quality of the voice and vocal communication, not only for verbal as well as non-verbal communication, emotional and cognitive well-being, okay, and improve self-esteem and confidence, improve group interaction and more concentration. So this will be helpful in the lot of the aspect, not only the physical as well as psychological aspects. So here you see that this picture will shows the child is treated with the help of the hippotherapy to improve the trunk control, neck control, okay, it's upper body control, okay. So gradually we can keep the child in various position on above the horse, okay. The horse will be the horse riders, okay, will be along with the horse. Usually 2 to 3 people need to assist when we may apply hippotherapy, okay. So one must be to stabilize the baby, okay. So one you see that holding the horse, okay, with the, so they will be keep the horse will be unstable. So the other one is the therapist can we can apply various skill on the child, okay. So the child must be properly fit, okay. So must be proper attire should be used, okay. Even helmet is mandatory. So these are all those things I will explain, right. Same like it's a some sort of the conditions we cannot use the hippotherapy, right. So active mental health disorders, okay. So if the, so it's having a lot of psychological disorders can treat with hippotherapy. At the same time, the person may having normalize, okay. So they will be in active problems, okay. So they may having some sort of psychological issues, okay. That's why we need to have a proper assessment before we start our treatment, okay. Acute herniated disc, if the already the person may having low back pain, they may having disc herniations may be there. So if we may treat what happen when we may apply hippotherapy, so the jerky movements will be there. So these jerky movements, the herniated disc will be further increasing. So this will lead to further complication. You all, as a physiotherapy students, we will know about the Arnold-Chiari malformation. Okay, it is some sort of neurological disorder. Some sort of the hindbrain is dropped down to the cervical region. Okay, due to this, the person may chance to develop the quadriplegia. Okay, so if the person may having like that symptoms like a Arnold-Chiari malformation, that is the contraindicated, because during the hippotherapy, what happened due to the movements, okay, so the complication may chance to develop atlantoaxial instability. There is a first and second cervical vertebra is maybe unstable. They won't have enough neck control. Okay, so if they may having instability, then it will be further complication may chance to develop. Same like if the person may having uncontrolled seizures. Okay, so it may chance to develop seizure at any time. When we may apply the treatment, the time if the patient may develop seizure, okay, or fits, okay, it will be further complications, okay, like a hemophilia. Either the person may having the urinary catheter, okay. So urinary catheter patients, if you may see, make the child or patient sit on the horse, what happen when their horse movement, the catheter may chance to move, it may be impinge or injury to the urethral regions, okay. So this will be level of complication, okay. And rheumatoid arthritis, okay, herniated nucleus pulposus, even multiple sclerosis during acute stage, okay. So this will be the time will be spread. Same like for the weight bearing areas, if the person may having any open wound, so what happens, so if the child or patient may sit on the horses, it will be maybe impinge, will leads to the open wound may chance to increase, as well as it will leads to the may chance to develop any infections, okay. So open wound is a contraindicated. Even the person may having very weak like osteoporosis will leads to pathological fracture, okay. Either very old patient, prolonged bedridden patients, okay. So they may having the bone will be very weak. So what happen if they may apply easily, they may chance to develop fracture. Unstable spine or unstable joints may be there, okay. That all will be in contraindication. So it's a very important as a physiotherapist when we handle the patients with hippotherapy. These are all the contraindications may be there the patient, so we need to explain to the patient, so you are not advisable to take for the hippotherapy, so that the patient must can get recover from that. Then we need to do for reassessment, okay. Then we can apply the treatment, right. So the safety is very, very important. Okay, patient safety equipment must be here. So we all know, even we are driving a car. Okay, seat belt is how important. When we are driving the motorbike, helmet is how is important. Same like when you do for hippotherapy, okay, so as a patient side, okay, so these are all the some sort of the safety equipment is very important, okay. So before a patient is introduced to the mount on the horse, okay, they should be provided proper equipments for riding. The first very important equipment is a helmet. So various size of the helmet will be there. The helmet must be fit to the patients, okay. So we need to use it according to the patient's head size. The helmet must be properly fit to the patient's head, as well as must use the chin strap. Okay, this chin strap to keep the helmet is not moving or swinging. Okay, because when we use the horse, okay, during the movements, okay, so our head will be moving like this. Okay, so the helmet still moving, then it will be discomfort to the patient. Okay, then sometimes it may be anything happen. Okay, so the helmet may chance to come out. So the chin strap must be properly fit. Okay, so that we need to check it before we may apply. Same like for the gait belt. Okay, so the patient should be fitted with the gait belt. Okay, so this gait belt must be hold with the either therapist or the those who having with the horse riders. Okay, right, so they will keep along with that. So the three persons must be there, okay, when we may apply hippotherapy. One is a therapist. We are concentrating to treat a patients, okay. So treat a patients, we are applying various treatment, and at the same time those who give a care of the horse, okay, they need to hold the horse, okay, they will be stabilize the horse, okay. And one more to the support to the child. Right. So, not only for the taking provide proper support as a patient side, at the same time, what horse we may use for the hippotherapy. So we need to have some criteria. Okay. Right. So the horse must be healthy. Okay. Right. So the horse have the basic need requirements. What are those things? It's a nutritional foliage like a grass and hay, okay, and that is the one is they take care of the horse, they will be take care of it, and adequate clean water. Usually the horse will drink, a healthy horse can drink around 20 to 20 liters water per day, okay, that is the one. So sufficient free roaming space and housing, okay. It should not be, it must be, because horse is a we all know about that in movies all we see the horse is a how it will be fast. Even the fast we can you usually use as a horsepower, correct. So it must be freely move, so it should not be kept in a very dungeon places, okay. So it must be roaming place, and check for the horse teeth, okay. If the teeth floating may be there, that horse is not ideal to take for the hippotherapy, okay. So there's a pain, the horse is not cooperate. Same like for hoof maintenance, okay. So that all those things will be the horse take carer will take, but as a hippotherapist we need to know about this all those things, okay. Right. So the hoof must be periodically need to check, okay. So it should not be injured, okay. So if it may be any injury will be there in the hoof, okay, the horse cannot able to stable, okay. So all those things, and periodical veterinary physician checkup must have, as well as the vaccination, and some horses may require an additional care due to the age and the health needs. So usually horse will be, the horse lifespan will be around 35 years is a maximum, okay. So some exceptional, either one or two horses may be more than 35 years. That age limit is at 27 to 35 is the ideal age, but some criteria is there to use for hippotherapy horses supposed to be 7 to 14 years. That age horses will be good in health, it will be in obey the commands, all those things. So this is a age group horse supposed to be used for hippotherapy, right. So the hippotherapy horses, yeah, what are the requirements of the hippotherapy horse? The horse must have no condition. Yes, either the horse may having any balance issue or any symmetrical issues or any health issues, okay. So that all the veterinary physician will check with the those who have in the horse riders, okay. Same like for the horse must be desensitized, yeah, to sudden external movements, noises and tools or props either physiotherapist uses, okay. So we cannot use simply all the horses as a hippotherapy, okay. So that horses will be specially trained, okay. So So that horses will be obey the commands, those who have a horse riders. Okay, so they will be just the expressions of the, because it's a horses are highly sensitive animal. Okay, so it must be desensitized. Okay, so usually female version of the horse usually we use for the hippotherapy. Okay, this because comparatively it will be more stable than in the male version of the horse. So the horse must be able to stand quietly for mounting and dismounting as well as grooming and tracking. Okay, so that type of the horse only we should select for the hippotherapy. A horse must have exceptional born etiquette. The people and the other animals should not upset them. Okay, and because it's a horse is a highly sensitive animals. Okay, right. These are all the some generalized requirements. Facility may require more in-depth requirements depending on the situations. Okay, right. So yeah, here you see that it's a therapy horse. Okay, so this is a horse from German. This horse is a highly sensitized. You see that during therapy time only the horse eyes will be kept in open. Remaining times it will be kept in the close. Okay, and so the horse will be very quiet. Okay, so you see that whatever the commands we may say, it will be in obeying. Okay, so it's a highly desensitized horse. Okay, right. Uh, Here you see that the videos of a few of the horses. Right. Right. Yes. Non-treatments are close. You see that horse eyes keep closed. Okay, because if you keep closed, okay, the external environment won't be affect to the horses. Okay, that is the reason. Okay, so the treatment horses like a hippotherapy horses, eyes are, okay, it's eyes and ears are highly sensitive. Okay, so eyes are kept it closed. It's an non-treatment time. So when we use the horses as a treatment time, that time only we use the eyes kept it in open. Okay, right. We can see some sort of the interesting facts about the horses. Okay, a horse lifespan usually 28 to 38 years. Okay, so usually 7 years, 7 until 7 years is like a kid. Okay, 7 to 14 years is like a adolescence horse. Okay, so 7 to 14 years horse usually is very ideal, we can use for the hippotherapy. Okay, and 14 to 21 years is the ideal age for the childbirth. Okay, so that is a time to the childbirth age of the horse. Then 27 and 28 to 35 it's considered as a old age horse. Okay, mostly for even riding horse also it usually used until the age of 28. Okay, so after the 28 mostly some horses may chance to have some sort of the health issues may chance to develop, and usually the maximum age of the horse will be in 35, but some very exceptional horses is there. Okay, so at present one horse is there, I think it's in German. Is the age is 54. Okay, and before that there is a one horse is expired at the in the year of 1964. The age of the horse is 62. That is the oldest horse in the world. Okay, but usually normal horses will be the lifespan is around maximum is 35 years. Then some more interesting fact is the pregnancy period of a human we have a 9 to 10 months usually we can say is correct. It's a 275 265 to 75 days as a human pregnancy period. As a horse you can take is around 320 to 380 days, more than 12 months. Okay, so 10 after 10 after 10 months, 10 to 12 months it will be there. Okay, heartbeat of the horse usually 50 beats per minute. As a human we are having 70 to 80 beats per minute, and heartbeat of the horse is around 50 beats per minute. Okay, right. Horse is I already told is a very sensitive animal. Okay, how it will be, the horse is in which mood, how we can recognize, we can see the horse ears. Okay, horse ears can rotate 360-degree. Okay, so it's a 3 o'clock, 6 o'clock, 9 o'clock or 12 o'clock. Okay, this is a position we can see the horse mood. Okay, so if it is a 3 o'clock position, okay, the horse is in very happy mood. Okay, so the 3 o'clock means if the horse ears must be in front like this. Okay, so this horse will be in very happy mood, or sometimes it may be very funny. So sometimes it will be very overactive like that. 6 o'clock, it will be calm down at the side. The horse will be very quiet and calm. Okay, right. 9 o'clock, it means ears will be behind. Okay, so this will be the horse will be very highly sensitive. Okay, it's not in good mood. Okay, and the same like for 12 o'clock, 6 o'clock, and 12 o'clock, the horse is okay, quite good mood. Okay, so either horse ear in which side it will be there. So according to that, we can recognize. Okay, the child is the horse is in which mood. Okay, right. So as a human, we all know we have a 32 teeth. Okay, right. So as a horse teeth, you see that it's in very big in sizes. Okay, so usually when developing horse is having 36 teeth are there. Fully developed horse is having the 44 teeth. Okay, even how the other animals like cow, other animals, we can identify. So how much the teeth they have, we can identify the age. Same like horse age also we can identify to see the teeth. Okay, right. Some other interesting fact like the first country used the horse as a war is in India. Right. Horse eyes also is high. How the ears are highly sensitive. Same like the eyes also is highly sensitive organ. Okay. Horse eyes can rotate 360 degrees. Okay, so it can see simultaneously in all the directions. Okay, and so it's a highly sensitive. It can view it's even very long distance any objects also. It can able to view very clearly. How the ears are highly sensitive. Even very distance, some sounds may be there. The horse can able to identify. Okay, so that is the reasons the horse may use as a war. Okay, and the sleeping time of the horse. Yeah, so as a human, our sleeping time usually 6 to 8 hours sleep is a we are in good in health. Same like for the horse can able to sleep even it may be stand. You see that anytime you may see the horse, it's a lying horse. You can see it's a very difficult to see. Okay, because mostly the horse can able to standing position. Even they may have any health issues, that time only the horse will go as a lying position. Otherwise, the horse will be always will be in standing. Even the horse can able to sleep with standing position itself. Okay, so usually it's a 3 hours sleep is enough if the horse having healthy. Okay, so if they may have any health issues, then the sleeping time will be affected either 2 hours or 1 hours. Okay, if the sleeping time may be affected, it will also leads to may chance to affect with some sort of the health issues. Okay, right. What is the relationship? Horse usually it will be not be as a alone. Okay, mostly it will be stay with it within its group. Okay, so either you can keep the horse will be separated with among the other horse. It cannot be able to live very long life. Okay, so it's a relationship always will be within groups. Usually the horse can eat around 22 kilograms of solid food as well as 11 liters of water. Sorry, wrongly mentioned here. It's 11 kilograms of solid food and 22 liters of water can drink every day. Okay, as well as the how many bones usually there in a horse? Because a human, as a healthcare profession, we all know we have a 206 bones, correct? So as a horse, it got a 204 bones. So the horse won't have a clavicle. Okay, so we have a paired clavicle as a human. Horse won't have a clavicle. Okay, so apart from that, other bones are there, but the numbers will be vary. It's not like as a human. Okay, even vertebral numbers are more than the as a human. Okay, right. So these are all some sort of the interesting facts about the horse. Okay, I believe you all got a brief idea about the hippotherapy. Okay, I didn't explain much about the hippotherapy. I very brief about it, but you have some eye opener. Okay, and I'm much interested in my future prospectus. Okay, so I wish to do my PhD in the field of hippotherapy. I will come as a almost is a end time. So what is a take home messages? Right, hippotherapy improve balance, mobility as well as the posture, and increase trust and improve self-confidence. Yes, okay, because the long term when we use hippotherapy, so they can have enough balance, comfort. Okay, so this will improve the self-confidence. Psychologically, they can improve anxiety level somewhat. Okay, anxiety will be greater reduction of anxiety. Okay, less feeling of depression and isolation, and increased self-esteem will improve the self-confidence, and even social skill also will be improving. Better impulse control, okay, self-control will be improving. Increased problem solving skill, even improving good in communication skill, not only with the verbal as well as non-verbal communication will also is improving. Better understanding of healthy boundaries and the importance of the assertiveness. So these are all the take home messages. And before I finish my presentation, I give a small story. Okay, is having about animals, how it will be influence as a human life. Okay, and there is a husband wife. Okay, they are just married husband wife. They have a lot of conflicts. Okay, they can they think they cannot be able to stable together. Okay, they wish to go for break down their marriage life, so they will go for the advocate. They cannot able to, because they complain to each other. He won't obey me. Okay, he won't respect to me. So like that, they are each other, they having complaining. So the the advocate gives some suggestions. Okay, he give one cat to the women and give one dog to the men. Okay, so please take this. Okay, and go your home. Okay, please take care of these things. Okay, these animals. Okay, so after 2 months you people will come and meet me. Okay, still you have issue, then I will proceed your divorce. Okay, so like that he is telling. Then they are taking this, and go back home. Okay, they show their interest to take care of the animals. Okay, so what happened, so they won't have time to fight each other, they won't have time to misunderstanding each other. They will give much care of the animals. So these things will give more interactions with them. So after 2 months they have very happy. Okay, and they will come and meet the advocate. We don't want to go for divorce. Okay, so why I tell this story to you people? Because the animals, we all have a lot of experiences. Okay, how the animals are behaving with us. Okay, so a few days before I read a simple message. The God gave the opportunity to talk in the as a dog. Okay, most of the human problems will be solved. Okay, because like that, most of the animals are evolved to improve their understanding about the as a humans. Okay, so this also you can take as a take home message. Okay, I believe you all understand a little bit. It's not, I didn't elaborately about the hippotherapy. I will give very basic, just eye opening about the hippotherapy. uh, I believe you all understand. Okay, so these are all my references. Okay, right. Uh, Thank you very much, Mr. Nelson, Miss Deborah. Mr. Nelson? Yes.
Thank you, Mr. Manikandan, for the insightful presentation. I'm sure our audience have learned a lot from this session. And before we begin with the Q&A session, I would like to inform that e-certs will be given for this webinar upon completion of a survey form. The link to the survey form can be found at the comment section. Dear viewers, if you have any questions for Mr. Manikandan, please leave a comment right now. We have our
Yes.
first question from Mr. Rahul Krishnan, stating interesting topic. Is there any age limit for taking this treatment?
Yes, Mr. Rahul, thank you for the question. And yeah, children's below the age of 3 is not ideal. Same like I told few of the contraindication. Okay, so if the person may having very old age, okay, the patient may having prolonged bedridden. Okay, so those people are not eligible to go for the hippotherapy. This will lead to various complications. So before we may apply for hippotherapy, even though the age group is okay, still we need to do for the further assessment. Even the children's, we need to do the pediatrician first to do the pediatric assessment. The child is apt for the hippotherapy. Then after that, we have a questionnaire is there. So the physiotherapist, we need to assess the child properly. Then only the child is eligible for the hippotherapy. So the children's below the age of 3 as well as old age peoples, okay, so they may having any general debility is a contraindication for the hippotherapy, right?
Thank you, Mr. Manikandan. Do we have any more
Yes.
questions? There's another comment or question from Udasir Baba. Very interesting. I have a question. What is the role and effect of hippotherapy in treating children with spastic cerebral palsy?
Ye- Yes, very good, Dr. Mudashir. Spastic cerebral palsy. First of all, to reduce the spasticity. Okay, so if the child may having the adductor spasm they have, so if when we may apply hippotherapy, we can keep the children's on the horse. Usually, as a physiotherapist, what we are doing, we use the gym ball, okay, and to keep the child's hip will be in abducted position, okay, or even simply we can use the pillow to keep in between the legs. Okay, so when we may apply hippotherapy, so to improve the pelvis control as well as to reduce the spasticity of the children. Okay, so keep the leg will be apart in both the sides of the horse. Okay, in sitting position, what happened, the hip adductor muscles will be in stretched position. So with along with this, when we do the movements, okay, so move the horse, what happened, the spasticity will be gradually diminished. Once the spasticity will be diminished, okay, so the mobility will be increased. Okay.
Thank you.
Right.
We have another question.
Okay.
We have the third question from Nisha Achari. Now, how frequent is hippotherapy advisable?
Yes, good question. Okay, so hippotherapy usually monthly 2 or 3 sessions according to the patient's condition, because we do the proper assessment before go, and usually monthly 2 to 3 sessions according to the patient's conditions we can apply. At the same time, each session duration usually 45 minutes to 1 hour. Okay, so we need to tailor, we need to proper assessment. According to that, we can plan the activities. What are the activities we can apply to the patient? As the physiotherapist, we need to decide according to the patient's condition. But usually, 45 minutes to 1 hour duration is the treatment duration, and monthly 2 to 3 sessions is a advisable one.
Thank you very much. Do we have more questions?
Okay, there's one
We
more.
have a question from Liu Yanling. Hi, sir. I would like to ask, how can
Okay.
hippotherapy help for delayed developmental milestone?
Yes, very, very good question. Because lot of the childrens are delayed milestone childrens only will taking as a hippotherapy, because you see that the children as a physiotherapist we are assessing what is the now according to the patient child age the milestone development supposed to be there. Okay, we need to plan what is the current milestone development stage of the child. Okay, so to control, okay, so milestone delay children they have a not enough trunk control, not enough neck control. Okay, they may chance to have a mobility issues. Okay, this all will be there. Okay, so we need to assess the child. You see that the previously I show the video. Okay, and the picture I will show, the child may having initially having the problem with the neck control. Okay, so can keep the child on the prone position usually when we use for the gym ball, but here we use the live tool as a horse. Okay, so to keep the child in a prone position on the horse, and we can create various activities in front of the child. Okay, so to keep the neck movement is above. Okay, so like the play activities we can encourage to improve the neck control. Same like can make the child sitting position on the horse. Okay, to improve the trunk control. Even you see that the child is in sit on the horse. Okay, the activity we train them from sitting to standing and use the tools. Okay, so like this situations, what happen, the trunk control will be improving. So like that we need to plan according to the patient's condition. What is the patient's need, we need to take note, and what are the things available, so we can correlate. According to that we can plan our treatment. So delayed development milestone children are can get very good progress with the help of the hippotherapy.
Thank you, Mr. Manikandan, for that information. I believe that is the end.
Okay.
We do not have any more questions thus far. However, viewers, you may leave a comment in the comment section and we will get back to you. We have come to the end of today's session. Thank you, Mr. Manikandan, for joining us today and providing such insightful information on hippotherapy. Also, special thanks to the faculty team members for their support in making today's event successful. To our wonderful audience, thank you for joining us at this webinar. We look forward to your comments and participation at future events hosted by MAHSA University. Please fill in the survey form, which can be found at the comment section by the end of this webinar, and ECERT will be awarded. If you have further queries, you can contact us through MAHSA website or visit our social media pages. Please do come and join us at our open days, which is on the 28th and the 29th of October from 9 a.m. to 6 p.m. Bring along your family and friends. We will be delighted to meet you. Have a pleasant week ahead till we meet again. Thank you and stay safe.